Hi there. I'm wondering about, there's a study done in UBC, and I'm guessing this is for Dr. Henry, and also some in, I've seen some out of the UK, where there's some question about the efficacy of one shot or how fast it wanes for people who are clinically vulnerable or older or who have cancer. And I'm just wondering how much that is weighing in or weighing as a concern of this 4-month span that we have planned here going forward.
Sure, yeah, and that's something obviously that we're watching carefully. The study from UBC looked at a very small number of people and looked at in long-term care, so both healthcare workers and residents, and it looked at antibody levels. And they found that the antibody levels were lower in long-term care residents in that small number. I believe it was about 18 people. So one of the things that we don't know yet is what we call a correlate of protection. So how much antibody reflects how protected you are. So there's other ways we look at that as well, and there have been other studies, one from the UK in a much larger group of people, that showed that antibody levels in older people actually were quite high for a longer period of time, which is all to say we're learning as we go. And one of the things that is really important that we're doing here in BC and other places around the world are doing as well is what we call vaccine effectiveness. And Dr. Skowronski and her team at the BC CDC have been doing this. And what it is we link people who've been immunized with cases, and we see how protective the virus, the vaccine is over time. And that is some of the data that allowed us to extend that interval and to recognize that we were getting good protection that was lasting for many weeks. So we will be continuing to do that, and we'll be continuing to watch. And if we start to see a decrease in protection, in real world protection, in vaccine effectiveness in elderly people, then we will speed up second doses for that group of people. Right now, the people who most likely have a second dose are people in long-term care, but it's not everybody. And we know that the age-based program as well, we're watching that very carefully. So we will continue to watch, and if we see a decrease in protection over time, we'll be looking at changing that. Same thing goes for certain populations, and really it is, again, another very small study that showed that people with certain types of blood cancers may not mount as an effective an immune response after a single dose and may need a second dose sooner rather than later. And again, the implications of that in the grand scheme of things are things that we don't yet know because it was based on antibodies. So we will be watching that again very carefully as well. And we've been reaching out and connecting with our cancer care colleagues in those very specific cancers that we're talking about, and we'll be monitoring people in that population to make sure that if that turns out to be the place, then we will adjust the time interval for those specific populations. So I think there's, the one thing we are learning is that we are learning more information about exactly who responds best, how long it lasts, and for most of us, it's going to be probably 4 months, depending on when our vaccine supply comes. But I also think we need to look at the data that we have from other vaccine programs and what we're seeing around the world. And it may turn out to be that a booster dose is most effective if it's given even later, so maybe 5 or 6 months for most people. And that may give us longer lasting protection that will take us through next year's respiratory season, now that we believe that coronavirus is going to be with us for a while. So those are things that we will learn and that will change and adapt as the program goes along over the next number of weeks and months.
Lisa, do you have a follow-up?
I do, and it's about the variants. You're mentioning how many questions you get. I'm sure I can imagine the mountain because I get some. But about the variants, P1 is one that seems to be catching a lot of people's attention because it's more than doubled in less than a week and did the same last week. And so I'm wondering if you could talk a bit about the concern of that. And if you can give again, last time you gave it, I think it was 10% of cases was a positivity rate of a variance of the number you were testing, or the number, now I'm going to get it wrong, the number that you're testing and the positivity rate of all, the percentage of all the variant cases that we have in BC were variants. Oh my God, I'm sorry, my words are so terrible right now. But I'm wondering if you can give us a bit of a look at what the percentage is overall and you're concerned about this P1 and if that affects kids going back to school especially in Surrey next week?
Yeah, I can answer the last one. The variants are just a new strain of the virus that have slightly different characteristics, and we're realizing that. The variant that we are seeing most commonly is the B117. We've seen it spread in the Lower Mainland in particular, and widespread. So we are, of course, doing case management and contact tracing aggressively around all cases, including the variant cases, and it's not going to affect return to school next week. The P1 is one that we are watching closely. As you know, we had seen a bit of a surge in the 351, the one associated with South Africa, but that seems to have settled down. The P1 we've been seeing primarily in Vancouver Coastal, but we've also had a couple of clusters in Fraser Health and in the interior. And so, yes, we are watching those very carefully. Most of those are no longer active cases. There was a large cluster in Vancouver Coastal that was contained once it was found. There's been 2 clusters in the interior health region, and again, both of those have been contained, but we are seeing increased growth. And again, that's something that we're watching really carefully. It is concerning because this is a variant that we've seen be very destructive in Brazil, and there's concerns about the effectiveness of vaccines. So my public health colleagues on the front lines are being very actively following people. What I can tell you is the majority of cases, even though the numbers are going up, they're clustered together, and they're groups of people who have been transmitting within that group, but we've been able to prevent the next generation of transmission. But it is harder the greater the number of cases there are. Overall, we are now screening with a test that looks for one of the mutations specifically. We're screening, it's close to 100% of all of the positives. It takes an extra day or 2 for the screening test to come back, and then those screened positives are going for whole genome sequencing. So there can be a delay of several days before we know what variant it is, and that's one of the challenges that we're working on. But we are now seeing a steady increase in overall percentage, and it's in the vicinity of the high teens and early 20s as of what I was looking at today. So we're in the high teens right now in the overall percentage of our cases that are variant cases.
Next question is from Penny Dufflo, CTV. Penny, are you there?
Hi, can you hear me now?
Yep.
Okay, sorry about that. Just going back to the UBC study, the authors specifically pointed to care home outbreaks we've seen in recent weeks as part of their conclusion that, quote, we recommend the second doses not be delayed in elderly individuals. So given the research and the fact that you said you do expect more outbreaks as visitations increase, why not revise the policy for the very elderly so that they don't have to wait 4 months for the booster, just in case the study is, in fact, pointing to a really big issue that needs to be addressed?
Yeah, so I think I would look at the outbreaks that we've seen in the last really one since people have been immunized as an example of how we are seeing very good protection in long-term care. And that is, the Cottonwoods outbreak, where there were a number of recently immunized people, as well as people, a very small number who had received 2 doses, but within a short period of time. And we had very mild illness, and thankfully nobody has died in that outbreak. So this is what we're likely to see, and we have other measures that we can take as well that need to supplement it. So looking at a very small number, 18 people, and looking at antibodies in 18 people doesn't change our management when we have other studies that have shown us that there is still a very high level of protection overall. And we do need to focus our attention on getting as many people that higher level of protection from a single dose right now. And that is our focus, but we'll be watching very carefully.